Welcome to Eagle Health Living. Today we delve into a pressing issue that doesn't get the attention it deserves, the rising suicide rates in Kenya. It's a topic often shrouded in silence, but one that demands our urgent attention. According to the World Health Organization, the suicide rate in Kenya is 6 per 100,000 people. That's 6 lives lost for every 100,000, a statistic that translates to roughly 4 deaths every single day. Think about that for a second. 4 empty chairs at dinner tables across the country every single day. It's a crisis, folks, plain and simple. In this first part of our series, we're going to shine a light on this dark corner and examine some of the key reasons behind this troubling trend. We'll hear from experts, explore the stories of those affected, and hopefully start a conversation that can lead to real change. Let's be honest, talking about mental health in Kenya is like trying to have a conversation about traffic in Nairobi during rush hour. Everyone agrees it's a problem, but nobody wants to be stuck in it. But here's the thing, folks, we can't afford to ignore this any longer. Mental health is health, period. Depression, anxiety, bipolar disorder, these aren't just big words you hear thrown around in American TV shows. They're real struggles faced by real Kenyans every single day. But here's the kicker. Accessing mental health services in Kenya is like trying to find an honest politician, theoretically possible, practically impossible. The system, much like our public transport system, is overcrowded and underfunded. There are simply not enough hospitals, not enough specialists, and definitely not enough resources to go around. This leaves many Kenyans struggling in silence, their pain invisible, their cries for help unheard. And let's not even get started on the stigma. Imagine breaking your leg and being too ashamed to go to the hospital because people might think you're weak. That's what it's like for many Kenyans struggling with mental health issues. It's seen as a personal failing, a sign of weakness, something to be hidden away, not addressed. But here's the truth. Mental illness is not a choice. It's not a weakness. It's an illness, just like any other. And just like any other illness, it can be treated. But for that to happen, we need to start talking about it openly and honestly. We need to break down the stigma, one conversation at a time. We need to demand better access to mental health services, more funding, more resources. We need to create a society where seeking help for mental health issues is as normal as seeking help for a broken bone. Because ignoring the problem won't make it go away. It's time to face this head-on, Kenya. Our lives depend on it. Let's talk about money, or rather, the lack of it. We all know that times are tough. The cost of living is skyrocketing faster than a Kenyan marathon runner. And finding a job is like trying to find a parking spot in downtown Nairobi. Nearly impossible. Now, imagine carrying the weight of unemployment, the pressure of providing for your family, the constant worry of making ends meet. That's the reality for many Kenyans, and it takes a toll, a heavy, heavy toll. When you're constantly struggling to keep your head above water, it's easy to feel like you're drowning. The future seems bleak, hope feels like a distant memory, and despair becomes a constant companion. For some, the pressure becomes unbearable, leading them to believe that ending their life is the only way out of the financial and emotional turmoil. It's a desperate act, born out of desperation. Now, we're not saying that every financial struggle leads to suicidal thoughts, but we can't ignore the link between economic hardship and mental health. When people are struggling to survive, their mental well-being often takes a back seat. We need to create an environment where people aren't just surviving but thriving. We need to invest in job creation, provide better access to education and training, and create a social safety net that catches people before they fall into the abyss of despair. Remember, a healthy economy is important, but a healthy population is essential. We can't build a strong nation if our people are crushed under the weight of economic despair. Let's talk about pressure, the kind that doesn't come from your mama asking when you'll finally bring home a spouse. I'm talking about the relentless pressure to succeed, the pressure to fit in, the pressure to be perfect. From a young age, Kenyan kids are taught the importance of education, of getting good grades, of landing a well-paying job. It's the Kenyan dream, right? But what happens when that dream becomes a burden, a heavy weight on their shoulders? The pressure to excel academically can be crushing. Long hours of studying, endless exams, the fear of disappointing your family, it can all feel like too much. And let's not forget the added pressure of social media, where everyone seems to be living their best life, showcasing their achievements, and generally making you feel inadequate. Then there's the pressure to conform to societal expectations. Get married by a certain age, have children, buy a house, the list goes on. It's like there's a pre-approved script for how your life should unfold, and any deviation is met with disapproval or even ridicule. This constant pressure to conform, to achieve, to be perfect can take a toll on anyone's mental health. It can lead to anxiety, depression, and a sense of hopelessness. We need to create a society that values well-being over achievement, a society that celebrates individuality over conformity. We need to teach our young people that it's okay to not be okay, that it's okay to struggle, that it's okay to ask for help. Because the pressure to be perfect is a recipe for disaster. It's time to rewrite the script, Kenya. Let's build a society that embraces imperfection and encourages our young people to prioritize their mental health above all else. Here's a thought. Imagine breaking your arm and being too ashamed to go to the hospital because you're worried people might judge you. Sounds ridiculous, right? Well, that's the reality for many Kenyans struggling with mental health issues. The stigma is real, folks, and it's deadly. In Kenya, mental illness is often viewed as a personal weakness, a character flaw, or even worse, a curse. It's something to be hidden, not discussed. This silence only perpetuates the shame and prevents people from seeking the help they desperately need. And if the stigma wasn't enough, imagine being punished for your illness. In Kenya, attempting suicide is a crime. Yes, you heard that right. Instead of receiving the care and support they need, people who attempt suicide can face legal consequences. It's like kicking someone when they're already down, then handing them a court summons while they're still on the ground. This criminalization of attempted suicide is not only unjust, it's counterproductive. It further discourages people from seeking help, fearing legal repercussions on top of the stigma they already face. The good news is there are efforts underway to decriminalize attempted suicide and to increase awareness about mental health. But we have a long way to go. We need to change the narrative around mental health. We need to educate ourselves and others. We need to challenge harmful stereotypes and create a culture of empathy and understanding. It's time to break the silence, to replace judgment with compassion, and to ensure that those struggling with mental health issues receive the support and care they deserve, not condemnation. Let's treat mental illness like the health issue it is, not a criminal offense. Imagine facing a challenge alone, without anyone to turn to for support, a shoulder to cry on, or a listening ear. It's a lonely and isolating experience, wouldn't you say? Now imagine facing the overwhelming challenges of mental health without a support system. It's like navigating a maze in the dark with no map, no compass, and no one to guide you. Sadly, this is the reality for many Kenyans. Strong family and community ties, which have always been a source of strength in Kenyan culture, are fraying at the edges. Rapid urbanization, economic pressures, and changing social dynamics have left many feeling disconnected and alone. When you're struggling with depression, anxiety, or other mental health issues, having a support system can make all the difference. It's a lifeline in a sea of despair. But what happens when that lifeline is missing? We need to rebuild those connections, strengthen our communities, and create a safety net that catches those who are falling through the cracks. We need to be there for each other, to lend a listening ear, to offer a helping hand, and to remind each other that no one should face their struggles alone. Whether it's through community initiatives, support groups, or simply reaching out to those around us, we all have a role to play in creating a more supportive and connected society. It's time to rediscover the power of Ubuntu, the African philosophy of interconnectedness. Remember, together we are stronger. Let's be there for each other, offer support without judgment, and remind each other that even in the darkest of times, we are not alone. We've covered a lot of ground today, from the crushing weight of societal expectations to the crippling grip of economic hardship. We've explored the devastating impact of stigma, the lack of access to mental health services, and the importance of strong support systems. Addressing these issues requires a multifaceted approach, a collective effort to create a society that prioritizes mental well-being. We need to invest in mental health services, improve access to care, and break down the stigma surrounding mental illness. It's crucial for friends and family to be aware of the symptoms accompanying depression, anxiety, and other mental health challenges. Let's educate ourselves, offer support without judgment, and encourage our loved ones to seek help when they need it. Remember, suicide has become a silent killer in our society, but it doesn't have to be this way. Arise, focus, and shine. Let's choose hope. Let's choose life, and let's work together to build a Kenya where everyone feels seen, heard, and supported.